the title that we were giving were what options are available. Coming from where I'm sitting right now, which looks a little bit different than it did a few years ago. I'm going to talk about legal options. I'm going to go through a little bit of background, go through some of the different ways that we categorize drugs in terms of whether they're approved in human and animal medicine, whether they're unapproved, compounded, and so forth. We're going to talk a little bit about extra-label use to set it up. And then we're going to go through the status of a variety of different drugs that are mentioned in the literature. And we're going to close with two focus questions. One is extra-label use of analgesics and anesthetics allowed under MDUCA. And the other one is extra-label use restricted to only those products that have an NADA or an NDA, a new animal drug application, or a new drug application. The previous presentation set this up in much more technically than I am going to here, but basically there's several different types of pain, disease pain, which can come from a variety of different physiological sources, as well as surgical pain, which can be generalized or localized. So a bunch of different reasons that we can want to use pain mitigation. Going through a quick survey of the drugs that are available in the literature. We're going to come back to these later with a little more detail about the underlined ones. But there's a variety of different non-steroidal anti-inflammatories. There's information available in the literature and frankly are being used in practice. Aspirin, Banamine, ketoprofen, phenylbutazone are some examples we'll come back to in a little more detail later. There's also local analgesics, anesthetics, such as lidocaine. Several other classes, acepromazine, the barbiturates, things like diazepam and xylazine. There's also a fair bit of information available in the literature, and some of these products are in use today. Rounding out the list, we have some opioids, bupropion, and things like ketamine, and a number of other things. Yohimbine at the bottom is related to xylazine, I suppose. We also have anesthetics as well, which were touched on briefly in the previous presentation in some ways, but isoflurane is of particular interest. We'll come back to that a little bit later. So the word approved is going to be highlighted throughout. Again, I'm taking this somewhat from the legal perspective, and our legal framework is the approval of new animal drugs, and that means that FDA has evaluated them for safety and efficacy. And in the case of food animals, that includes safety for the target animal, the animal being treated, as well as human food safety. So in order to be legally marketed, an animal drug is subject to either an approved new animal drug application, an approved generic application, which is an abbreviated new animal drug application, a conditional approval, which is predominantly for minor use, minor species, or an index listing. The last two are sort of special circumstances. The major ones are the first two, our formal pioneer and generic approval process. Unapproved animal drugs, there is no pre-approval review or post-approval monitoring, at least formally through FDA. So, effectively we can't vouch for the safety ahead of time, and we're not actively monitoring the experiences with those products as they're being used. There is some concern, especially when we're comparing those companies, those drug companies that have gone through the process of seeking approval. There may be some unfair market advantages to those products that haven't had to make that investment and demonstrate that safety and efficacy up front. It also, to some respects, reduces the availability of legal products. So animal drugs illegally marketed in the U.S. have not been approved by the USDA and reviewed under FDA's legal review process. Compounded drugs, I'm going to touch on that briefly because they do come into play under the extra-label drug use. So there's a specific treatment of compounded drugs, and compounding in both human and veterinary medicine have received more attention, particularly over the last several years. Compounding from approved drugs, so drugs that are approved may be used in the compounding process legally under the Extralabel Drug Use regulations. Compounding from, I think where in a practical sense where the line is really drawn is where we move from compounding to manufacture. So when compounding from bulk ingredients instead of from new animal drugs, and so from raw ingredients, not from the drug, that's considered an illegal compounding act. So that's we'll come back to this a little bit later, but setting up our how compounding fits into legal extra-label use of drugs. The highlighted text here and of particular concern from in food animals again is the human health aspect of this. In addition to in human medicine and in companion animals, we evaluate safety and efficacy in the animal that you're treating. Food animals, there's that additional concern of the food safety or the human health impact. So if there's a potential for unknown or unsafe residues, this brings us right back to the topic of this symposium and the precautionary principle. If there's an unknown safety concern, we can't vouch for its safety. So we're getting to extralabel drug use. The human medicine and in companion animal medicine, this is a much more available option for physicians and for companion animal veterinarians, and again mainly due to the concerns with the food safety. The extralabel use in food producing animals came around fairly late. Congress passed the law in 1996, I believe. So it's only been relative, and FDA finalized our regulations in 2001, I think. So it's been relatively recently that we've, in food animal practice, we've had the legal support and legal backing for using products in ways and in species and routes of administration that haven't been formally approved on the label. So that's really what extralabel use means in this case, using it in any way that's not specifically approved on the product label. And the word approved is highlighted several times here, and our extralabel use restrictions are for the most part restricted to the use of products that are approved themselves. So extralabel use of unapproved products in ways that they might not have necessarily been approved for, as opposed to the use of products which are not approved in the first place. Of particular importance to this conversation, pain management in particular, the prerequisites for in food animal medicine for an extralabel use to be valid is that it has to be intended to relieve suffering. So there has to be a risk of suffering or death, or where the health of the animal is threatened, in order to constitute a valid extralabel use. So convenience for the operator, the veterinarian, it does not meet this threshold. Production uses, increasing rate of weight gain and so forth, don't constitute a valid extralabel use. But when we're dealing with mitigating pain, that clearly fits into the alleviating suffering. Some other details in terms of the requirements on how, when extralabel use is appropriate. Essentially, it has to be in a prescription format by the order of a veterinarian. Again, with the human food safety concern, it must not result in violative residues in the animal tissues. And there are a list of drugs that are prohibited from extralabel use. Those products are not to be used in food animals at all. Regarding the residue issue, the requirement is for the vet to set extended withdrawal times. Again, an additional margin of safety, and perhaps another example of a precautionary approach to setting some boundaries around this particular set of use conditions. And this all is right in our regulations, is that the vet is to set appropriate measures to ensure timeframes are met. And so we really put a lot of pressure back on the veterinarian himself if there is evidence of a tissue violation that can be traced back to an extra label use, where the vet is really on the hook and so, held responsible for ensuring the safety of the food supply, particularly when these products are used outside of their approval conditions. So this is going to go through a series of check boxes. I'm not going to push you to be overly participative, but maybe mentally you can ask yourself as we move through if each one of these categories can potentially be used in an extra label fashion. Approved animal drugs, yes, they can be used in an extra label fashion. Approved human drugs, they can also be used. What about the conditionally approved drugs? Those are for drugs that sort of have a pass under minor use and minor species. No, not so much. And so there's some aquaculture products and things for sheep and goats, and so some species are impacted by this, and as well as some specific diseases. Indexed animal drugs, that's a little bit of an obscure one, but those drugs cannot be used in an extra label, legally be used in an extra label manner. Medicated feeds, they're actually prohibited from any extra label use. Medicated feeds are to be used according to label, no exceptions. VFD drugs as a subset of medicated feeds, no provision for extra label use. Human over-the-counter monograph drugs. This is a little bit of an obscure one, perhaps, but in human medicine, or the human regulation of drugs, there are products which actually have not formally gone through a USDA review, but there's evidence available in the public domain in the form of a monograph, and that in the human realm creates a framework to use these products. In the animal and food animal realm, that does not suffice. Unapproved animal drugs, they're unapproved, so no extra label use. Got one more check mark in here. Drugs compounded from approved drugs. So compounded products can potentially be used in an extra label manner if they're compounded from other approved drugs. Drugs compounded from bulk ingredients, no. So the subset of the different possibilities that we can really work with in food animal medicine is fairly short, and it boils down to approved animal drugs, RX and OTC only, as long as they're not medicated feeds. Approved human drugs, and drugs compounded from other approved drugs. All the other ones potentially are not legal to be used in an extra label manner. So we're going to go through some of the drugs that we listed earlier, things that are available in the literature, and kind of check back in on them in light of the other things that we discussed. Aspirin, for example. I know personally that it is used. I have used it in practice. It's unapproved in animals. There is an OTC monograph in humans. So technically, no legal extra label use of aspirin. Sodium salicylate, unapproved animal drug. No legal extra label use. Banamine, approved in animals, horses, cattle, and swine. It is marketed. I know Banamine has some particular concerns related to the route of administration, but the rationale behind using that product in an extra label manner in different route of administration, for example, would have to be to alleviate the suffering and to address the health of the animal. Ketoprofen, there's an approved animal product. So that could potentially be used in an extra label manner legally. Phenylbutazone, approved in animals.
But there are some restrictions on phenylbutazone for
Yes, there are, and the prohibition. So that our extra label. Thank you, Gates. Our extra label regulations provide for a list of specific prohibitions, of which phenylbutazone is subject in food animals. Lidocaine. This is an interesting and relatively awkward one. It's unapproved in animals. Frankly, there is no approved lidocaine product as far as I'm aware. There is an approved product in human medicine. I know personally that I never used the human lidocaine product. So technically, all unless you're using a bottle of lidocaine that is the human approved product, technically that's an illegal extra-label use. Thiopental, approved in animals, dogs and cats. It's not currently marketed as far as we can tell, so some of these things may be purely academic, at least currently. But this would be a situation where this could potentially be a legal option for extra-label use. Diazepam, similarly, not marketed, but it is approved in companion animals anyway. So under our legal framework, it is a potentially valid option. Midazolam, however, there don't appear to be any approvals that we can reach to. And skipping to xylazine, we do have approval in several species. This would, as long as we meet all the other requirements under AMDUCA, this is potentially a valid product for extra-label use. Butorphanol, approved animal products. Metomidine, yes. Ketoprofen, also approved animal products. Isoflurane, similarly, has approved products. So there are a number of products which are mentioned in the literature in terms of some evidence about how they work in food-producing animals anyways, and do meet the criteria for legal extra-label use based on their approval status. And working within the other frameworks provided in our extra-label use regulations are potentially legal options to reach for. So I'm going to close with our two questions. Hopefully I've caught us up a little bit on time here, but close with our two sort of focused questions here. Is extra-label use of analgesics and analgesics permitted under our extra-label use regulations? And based on the standard that the requirement for legal extra-label use in food animals is to alleviate suffering, the clear answer is yes. Is the extra-label use of products restricted only to those products that have been approved by FDA, either as a human product, which is the NDA, or as an animal drug, which would be the NADA? The answer is a qualified yes. And again, I hope this was somewhat useful. I know this is a very difficult subject, and personally, I find this a little bit challenging mentally, having done some of the things that don't necessarily fall into the strictly legal boxes going through this presentation. I think it's an important discussion, and I'm glad to see folks moving it forward. I know that internally we're struggling with this issue in terms of how to manage the competing demands to improve animal welfare on the ground as well as to protect public health. So I'd ask if there's any questions and hope we can continue the conversation.